Hello, everybody, and welcome to the Better You podcast. Today, we are looking to understand anxiety. By the end of today's conversation, I hope you'll understand anxiety differently and leave with at least one practical tool you can use the next time it shows up. So, without anything further, I'm joined by Ravi and Dr. Tilton, and let's get into it. So, Dr. Tilton, I know that we all experience anxiety and we've had some discussions around it on this podcast before, but why would you say it's a little bit different than something like depression or bipolarism or one of the more, I don't want to say severe, but
There are severe mental illnesses
stra-
like schizophrenia and bipolar is considered
yeah.
a severe mental illness. So yeah, they're out there. Depression and bipolar um, are mood disorders, and anxiety disorders are in different class in the DSM. So they're split. Now, some people have
Okay.
depression and anxiety. Frequently, there's very frequent overlap between the two. But yeah, anxiety disorders are a distinct category.
Okay. And what separates a disorder from just your day-to-day I'm anxious?
A disorder by definition has to impact in a negative way your occupational or educational functioning. So every disorder has that. Um, so yeah, with anxiety, also, I mean, if something doesn't meet full criteria for what the DSM lays out, like you say you have to meet 3 out of 10 criteria to be actually diagnosed with it, then you would just say they have like that anxiety traits.
Okay. Okay.
Yeah.
That makes sense. I feel like to me, anxiety is a really interesting one because it is like when I experience anxiety, it can be really terrible. You know, you have trouble sleeping, your brain's kind of frazzled, there's all of these things. But at the same time, it can be motivating to an
Yeah.
extent and depending on how severely you feel it, whereas I feel like something like depression or one of the mood disorders it always is demotivating, like there's not a positive that comes with it.
Yeah. And I've seen people in therapy, I've seen two people in therapy actually who came in and said, I have tons of anxiety. My wife told me she can't take it anymore. I have to get help. It's really hard for me, my job. And they said, but I don't want to completely get rid of it because it does make me motivated to perform well. And there's a certain, it's, kind of like a bell curve, like you're going up, 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 and then down. Like it gets to a point where it is help motivating you. And if it gets too much, then it's detrimental.
That's a really good analogy. I would say almost like at least for me, it's almost like a cliff where it's like, okay, it's great, it's great, it's great, it's boosting my productivity, and
Yeah.
then I'm burnt out and stressed, and I can't focus on anything long enough to be
Yeah.
productive.
It really doesn't feel good. Not that any disorder feels good, but honestly, I think I'd rather be depressed than have anxiety because then when I get it, I don't really have it very often, but when I have it, I find it so uncomfortable physically and emotionally, mentally that I'm like, oh, this is this is horrible. This is horrible. So yeah, and there's a lot of different types of anxiety. There's generalized anxiety, social anxiety, separation anxiety, selective mutism is anxiety disorder. So there's a lot of them, and they all generalized anxiety and like social anxiety both have apprehensive expectations. So you're afraid of what's going to happen for a future event. You're not anxious you're not anxious before that event, but then when that's happening, you get real anxious because, say, in social anxiety, you're scared of a negative evaluation of whether you're giving a speech or a performance or whatever it is that you're going to be doing in front of other people.
Dr. Sultan, it seems like you are aware of your anxiety, where like some people, or at least from my end, were like, I don't know like how to feel anxiety. Like what would be an anxiety type feeling, and how can you differentiate between like a depression, like you mentioned, or anxiety?
Yeah. Well, anxiety has a lot of, well, depression has a couple physical components as well, but anxiety has many physical components. Like your heart starts beating, you might be sweating, your hands might be, kind of, um, what's that word I'm looking for? Your palms are sweating too. You're not able to think clearly. Maybe your breath changes, and then you're not giving it enough. You're doing shallow breathing, and you're not getting enough oxygen to your brain, which then makes it harder to think clearly and make good decisions. And depression, is more like it might affect your sleep and your appetite, but those are neurovegetative symptoms, but the rest are, like feeling sad more days than not, losing pleasure in doing things you used to find pleasurable. That's one of the big criteria. Um, Lack of motivation, lack of concentration, stuff like that for depression. And anxiety has that to a certain extent as well, has the lack of concentration. Because your mind is just kind of spinning because you're so nervous.
I think you brought up something that I actually remember from anger management, but I have used it to decent effect with when I'm feeling anxiety symptoms, and that is like you were talking about. You go to shallow breathing, but I found that if I recognize I'm in having anxiety symptoms, if I take deep breaths and I do box breathing,
Mm-hmm.
um, you know, inhale for 4 seconds, hold, exhale.
I'm
Yeah.
just going to say that.
Um, what?
I was just going to say that's one of the tools you can use to like change your breathing. So that's great that you said it.
But I found that for me, for anxiety, it's really good, not long term, but it's good to give you enough of a hold on it so that you can kind of take the next steps.
Yeah,
Um,
agreed. It's in the moment.
yeah,
Like you said, long term, you're going to have to develop some other tools, which cognitive behavioral therapy is great for. They have a lot of tools to work with anxiety and to teach people.
mhm.
But yeah, in the moment, when you're on stage or you're about to give a speech, that's one of the things that works the best.
Oh, I'm curious about in terms of like, is it a revolving thing, like in anxiety? Like when you studied anxiety when you were in college, right? Or when you go back to the 1900s or 1800s, in the evolution, like factored into like different environmental or economic. So just wanted to see if there is a science behind that.
Well, I know women are twice as likely to be diagnosed with generalized anxiety disorder than men in the community. Um, for the average prevalence is like 2.9% for generalized anxiety disorder. So in terms of like economically, how that's involved, if it's usually people who are in like a Western civilization, more economically successful country or town, whereas in other countries, maybe when there's like more poverty, they they have stuff to worry about, obviously, but it doesn't usually rise to the point of a disorder, or they don't recognize it as a disorder.
Wow. And has it evolved since you last studied?
Yeah, I think the techniques for assisting someone with it have evolved.
Okay.
Definitely.
It's very fascinating when you like mention the geographical differences. And then on that note, do you also think is there a culture aspect where anxiety might feel something different to someone else?
Yeah, and it might be manifest differently by different cultures. Like a lot of somatization might happen in other cultures where you have the most common somatic symptoms are GI problems or headaches or nausea. So that might, in other cultures that don't really recognize some of the Western cultures or Western civilization cultures, wouldn't necessarily even go to therapy and say like, oh, I'm having a lot of anxiety. They would maybe just keep it like within the family and have those symptoms that are somatic.
Wow. And then would you count a phobia as a part of anxiety?
Oh yeah, there's social phobias and specific phobias. Like specific phobia would be spiders, heights, um, tarantulas, snakes. Those are the most common ones.
Wow.
Yeah.
So one of the things, and we touched on it, at the very beginning, and I wanted to go back to it, is how, anxiety can be a motivational fuel, and then, it works out really well until it doesn't, and then it's kind of overwhelming. Are there, you know, techniques that people can use, or things that they can look out for to kind of say, okay, let's keep it from getting to that overwhelming point where it starts to impact my day-to-day life or my job or learning or whatever?
Yeah, well, I think in therapy that some of the tools we would teach people are like grounding techniques, and we would work on cognitive distortions about their anxiety. Um, a really common exercise is to say, okay, so this I'm anxious about like this topic. So what are the chances? So what are you anxious about? What are the chances of that happening? Like what's most likely to happen? And if that did happen, what would be the consequences? And if those consequences happen, would they matter in a week, a month, or a year? So sometimes people do that to kind of talk themselves off the ledge. For grounding techniques, it's when you do 5, 4, 3, 2, 1, and you say, like, what are 5 things you can see? What are 4 things you can touch? What are 3 things you can hear? 2 things you can taste? And one other sense, I just forget.
No.
I forgot the last one, but it's all your senses, and it just goes, you can put them in whatever order. You can say, hearing 5 things, or seeing 5 things, or touching 5 things. They don't have to be in a specific order.
And I feel like all those questions are asked for you to try your best to be in the present, right?
Yeah.
That's what it seems like, at least. So that's very interesting. Okay.
Yeah. When you have anxiety, it revs up your autonomic nervous system.
Okay.
And that's then why you have all those other symptoms I was talking about, like increased heart rate, sweating, not thinking clearly, all those ones I mentioned earlier.
Gotcha.
So I have a question around anxiety and planning.
Mm-hmm.
Because I feel like a lot of us, myself included, when we're anxious, we plan, like we'll obsessively plan.
Uh-huh.
And to an extent, I kind of like what we were talking about earlier about how it can be good, but it can also be really bad. I've seen where I've done this, and I have friends and family that have done this, where we'll obsessively plan, and then the plan's really good, but once it starts to go awry, then the anxiety spikes to a whole new level where we're just difficult to work with, difficult to rein in, um, and everything like that. So my question is, when it comes to planning, would you say that ends up being, in general, ends up being more beneficial or inhibitory? Because I feel like I've seen it be both, if that makes any sense.
My opinion is that it's helpful to have a plan, because hopefully then there's less likely chance that things are going to go wrong. Now, if a big curveball comes in, then that's when I think you would do like the breathing. Maybe if you're able to take a little time out, do quick meditation or something. Do a quick tool. Use a quick tool that it can kind of try to rein it in and get you back on track.
Yeah.
Because you can't plan for everything,
That's true.
Yeah.
I've seen a lot of people talk about when they're having anxiety, they mentioned that they're having panic attacks.
Mm-hmm.
So what is the the mindfulness between those two things, or is that like separate?
No, what's the mindfulness for?
Like panic attacks, like is there a disturbance in your brain that causes that?
Well, yeah, and that's another one where you get a lot of mainly physical, well, physical and cognitive anxiety, but like you get, again, the increased heart rate, all those symptoms that we mentioned previously. But then you're also, you're in your mind, you're telling yourself like, I can't do this. I can't go out there. If I do that, then something bad is going to happen to me. And it really, they can last a few minutes, or they can last longer. But eventually people who have a lot of panic attacks, they start to get panicked about having panic attacks in the future. And they're like going crazy, and they can't control them, and they're going to look stupid, or they're going to look crazy if they have one in public. So they like don't go out in public as much. So then there's agoraphobia. And that's one of the things. There's different types of agoraphobia, but that's the main one, is you don't want to leave your house.
So, totally random story, but I was thinking about this in terms of panic attacks when I was younger, pre-adolescent, teenager type age. I had a lot of social anxiety, and I struggled with talking to people normally and everything. And one of the things my therapist at the time recommended to do, I call it don't think, just do. But it was like count to 3 and then do the thing that you want to do. Just start doing the thing that you want to do without thinking it. For me personally, it's always worked out. Somehow it has never led me wrong or led me astray. But now that I'm thinking about it in hindsight, I'm like, there's a lot of possibility that I could have just leapt into something and it would not have worked out.
Yeah. Yeah. I mean, I think, going back to like, what's the worst thing can happen scenario? If you think about that. Now, I mean, there are things that if something happened would be really terrible. Like, you're anxious about, some people get really anxious about someone dying like in the middle of the night and they won't know. And, maybe, or someone just, passing away from like a disease or old age or whatever. And they worry about that all the time when A, you can't control it. And B, you'll find out eventually, it's not like no one's going to tell you. So to kind of use those, think about it that way. And that, yeah, it would be terrible. It would be very upsetting and sad, but you can't do anything to control it. So to worry about it is kind of a waste of your mental space.
Yeah. There's a quote that I'm paraphrasing that said, basically, when life hands you hardship, there's one of two things are true. Either A, you can do something about it, at which point don't worry about it, just do the thing that you can do. Mm-hmm. Or B, you can't do anything about it, at which point worrying isn't going to help you anyway, so don't worry about it.
Yeah, that's a good way to look at it. Yeah. And then there's also separation anxiety, which a lot of people, I think of children getting that, or dogs. Like my dog.
Anxiety.
Yeah. And that's when you have you're very nervous about not being in the presence of an attachment figure. You think something's maybe going to happen to them, or something's going to happen to you. And so it's very anxiety provoking when they are not with you.
That makes sense.
Yeah.
I feel like a lot of us tend to naturally develop attachment figures, loved ones, partners, animals, and it I don't know that it causes anxiety when they're not around, but it lessens anxiety when they are.
When they're present,
yeah. And I think that, like, I've heard so many people bag on like anxiety animals or
like at the airport, you see someone. Sometimes in the airports now they have animals that, like dogs, you can pet if you're anxious. Or you have emotional support dog because you're anxious maybe when you fly or wherever you're going or what you're doing.
Yeah. But I have to say, like, if that helps you, and I have no problem believing that it helps people, like, power to you, because sometimes I'll be having a rough day, and just cuddle up with my dog and pet him, and he kind of looks at me like, oh, okay, sure. Um, but it's a very relaxing thing, and for some reason, for me, just kind of doing the motion of petting and being in that moment is very calming, and it helps me get back to the area where I can be productive again.
Yeah. Yeah, I agree. And I would put that, maybe not everyone would, but I put that kind of in the category of a grounding technique because it's kind of helping you recenter, you have time to like take a deep breath. It's, like you said, the motion of calming, and the motion of petting them is calming. And yeah, that's a really good one. And even for our pets, they have anxiety blankets. Like they're almost like a swaddle, and they're called like thunder coats or something. And you put them on them whenever they get anxious, and it's supposed to like help them feel like they're like with you, getting petted. I don't know if it works or not, but they have them out there.
We've had to do that for my cat when during like a really bad storm.
Yeah,
Usually he's not anxious at all, but when he's anxious, he's like crazy uncontrollable anxious.
yeah,
And so, we'll wrap him up in a blanket or towel and like quite literally swaddle him and hold
yeah,
him, and that seems to calm him down.
yeah. My dog is also very anxious for storms and like with the fireworks most recently
Oh my
and stuff
gosh,
like
yeah.
that. So yeah, but he gets he gets a trazodone. That's prescribed by the vet. I didn't just give him one of mine. Um, yeah, so that seems before we go to the vet, I always do her grooming because he gets so anxious that he can tend to get a little aggressive, and he's not an aggressive dog
Mm,
normally at all, just in those situations.
Mm.
So I have to give him that to kind of calm him down before we go.
yeah. I think that's something that's important for people suffering from anxiety and for people dealing with people suffering from anxiety to understand, is that when you're anxious, your emotional state is so out there that like things that you would never do seem totally reasonable just because you're, at least this is what I've experienced. Maybe this isn't what everybody experiences, but like you're immediately responding to stimulus without even recognizing what it is or what's going on or the full picture. And
Mhm.
so like you can end up lashing out or yelling or breaking things, um, depending on your level of anxiety and control, um, which is why I'm a big fan personally of what you were calling the grounding techniques, kind of the things to get you back to just being able to function. Because I feel like, you talked about CBT and DBT and other things that you can do long term to help manage your anxiety. But I have to say, for me personally, like when you're in the moment of it,
Right.
it's so hard to
It's hard to rein that
grab
in.
onto those. Yeah. And then I feel like once a grounding technique kind of brings me back to center, then there's so many other ways for me to proceed that kind of mellows it out and makes it work for me.
Yeah, and also like distraction techniques can be good. It doesn't solve the overall problem of anxiety, but it's another kind of in the moment one. Or like before, say you're gonna do some public speaking and someone else is on before you, and you're sitting there and you're getting more and more anxious. You can do count back from 100 by sevens. That's a really common one because it distracts you. And for me, it's hard to do that math, to do that math by sevens and still be anxious. So I have to really concentrate on that. But yeah, and well, one thing in therapy that we would work on definitely are cognitive distortions or thinking errors, they're sometimes called.
Mhm.
And you're probably very familiar with a lot of them, like one's all or none or thinking or dichotomous thinking, however you want to call it. Um, Catastrophizing, when you think, one little thing is going to affect the rest of your life in a major way. Jumping to conclusions, a lot of us do that. Because we automatically assume like it's the worst thing is going to happen when you don't have that information yet, maybe. And then, what was that I was going to say? Oh, this discounting the positives. So when something positive happens, you'll be like, well, that was just luck. That was just luck. And if something negative happens, then you internalize it and you're like, God, I'm so stupid. That was totally my fault. So you're attributing them to two different things, even when something positive happens.
So one thing I've noticed with me and actually with a lot of people in my family, so maybe it's a genetic thing,
Mhm.
is that um, anxiety can trigger after a string of positives where like you just start waiting for the other shoe to drop and you're like, okay, something bad is going to happen now.
Hmm. Yeah. A lot of people, that's, I think, like discounting the positive. Um,
That's what I was thinking when you mentioned it. I was like, I bet that's what that is.
yeah, that's exactly how I would describe it. Yeah. Um, and that again is like you're not giving any, most likely, you're not giving any credit to yourself for the role you played in the successes. Um, but you certainly give yourself all the credit in creating negative experiences. So that's another thing that people can work on in therapy.
Dr. Phil
I
said,
think
no, I was gonna say one of the things that you mentioned was social anxiety. Like feel like today's day and age, you see that so often and so common, where people are afraid, to like either go out or just are being. They think they're being judged, right? When
Mhm.
when studies show, not study, when like naturally just shows like no one's caring that what you do, like no one's
Most people don't. They're more concerned with themselves,
exactly.
but more so than they're, like, how do I look? How am I, how am I acting? Am I doing a good job? Whatever. Than like evaluating everyone else. I mean, sometimes people do judge other people, obviously, but most people are more like cognizant of what they're doing and how they're presenting to other people.
Yeah. So what causes the social anxiety aspect? Like, is that
Um,
is that like
Again,
like genetics? Is that is it
genetic is a big part of anxiety.
okay?
Um, if you had like a prior really bad, say you had a very bad private old experience with public speaking,
Mm-hmm.
then in the future you might be like, oh my God. Like I was really anxious to do that, and I had to do I had to do a speech about. It doesn't matter what it's about, but I did do a good job. That's the bottom line. And I looked out, and people in the audience were like, "What?" Like I could see them being like, "What is she even talking about?" And I got so anxious after that. And my boss pulled me into his office and said, I know, he's like, I noticed you seem very anxious. Is that something you would like help with? And I said, well, not if it involves doing more public speaking. I was like, no, but I did. And I even went to Toastmasters at several people's insistence that I go and work on it. So, which I did find helpful actually.
Well, yeah, I was gonna bring up that point of like, can you adapt to that? Like, where like, okay, you speak more and more often, where like it's just naturally built in. After that, is like, okay, I'm fine, I can do this.
Yeah, yeah, and what people have told me that I find really helpful, from parents to bosses to whoever have said to me, remember, you know more about that topic than most people in the room.
Very
Now,
true.
if you go to like a conference and there's like leading people in anxiety in the audience, that might not be true. But and they'll ask you questions, and some some you don't. All you can talk about is what you know about, and say, I don't know the answer. I can get the answer for you, or maybe you have the answer, and you want to talk about that. So yeah, I think the more you do it, the more comfortable you become.
I've been in a social settings where like top level like CEOs or principals that would like come up and then will be friend based. They will say like, "Oh, I'm having anxiety." So like in that situations, like how can you help someone? Or, like what can you like do to calm them down basically?
Um, well, I'm not pushing medication.
Of course.
But some people want to take it, some people don't. That's fine.
Yeah.
I respect whatever decision someone makes. But I mean, there are medications out there that you take like as needed like a Xanax, a Valium, something along those lines that you can take, in a real small dose that will just kind of calm you down, but not affect you cognitively. But or beta blockers also
Mm.
work on the physical symptoms, but not on cognitive or cognition at all.
Gotcha.
So yeah, that's something you could do, but right before, you're going to speak or to go into a situation like a party that you don't know many people, things like that. Other than that, I'd say the other things we had talked about in terms of grounding techniques and asking yourself, okay, what's the worst that's going to happen?
Yeah.
I used to testify a lot in federal court and as an expert witness, and I'd get so anxious before and just study what I was going to say. And then on the way when I was like walking up to the stand, I would get like really eerily calm. So I'd be like, it's out of my hands now. I did all the preparation I can do. All I can do is answer the best that I can. I can't change anything at this point other than I can change the information I give people, but I can't change, what the other attorney says, what the judge thinks.
Yeah.
Yeah.
So way back in the day when I used to perform live music, I used to get performance anxiety, which I think everybody does to some extent. But one of the things that I was told to do, and I don't know what it's called, but I've heard similar advice from other people, is like pick a fixed point in the room and
Mhm.
just you know perform or speak to that, especially if it's something that's out of the ordinary. So I literally used to have like a little figurine or doll that I put like on the bars or like on a ledge or somewhere. And if I was kind of getting in my head, I would stare at that and then come back to, okay, uh, now I can look at all the people expecting me to perform.
Yeah, in yoga they call the drisky, which is a point of focus. So it's serving the same exact purpose. When you start, like, you start to want, your mind starts to wonder, then maybe it'll affect like your balance pose or something. You go back and look at and they have one on every yoga mat or yoga towel at the top of the towel, so you can focus on that. But you can find stuff in the room too. So I think it's exactly the same as what you're talking about. Yeah, and it is helpful. I found it to be very helpful, both in real life and in a yoga class. Not that yoga is not real life, but you know what I mean.
Yeah. No, I mean, I do think that one of the things that I find so interesting is that um, a lot of the tools that we can develop for anxiety or for anything else that we might be going through mentally, um, have applications outside of the specific disorder or whatever we're going through, um, quite frequently. I would say more often than not, like, oh, you're experiencing acute anxiety, and then you learn all these techniques to deal with the anxiety. But once you have managed that anxiety, those techniques stay with you and you can apply them to other situations where the anxiety isn't quite as acute or you just need to relax a little bit.
Yeah.
Um, and to me, I think that's just such a valuable thing to have, that essentially tool chest of techniques that you can use to stay on top of your mental game, for lack of a better phrase.
Yeah, I think a lot of these apply to, like you said, they apply to a lot of different either disorders or anxiety situations, um, where you can, it's a lot. That's why cognitive behavioral therapy, I think, is so successful in treating so many disorders, is because once your cognition is compromised, and your thought processes are compromised, it doesn't usually go that well. Because obviously we need to be able to think clearly. Some of that, like, we mentioned earlier, some people, you start to worry and become more and more anxious. So then you make impulsive decisions, which might not like right the ship exactly. But, and that's part of your prefrontal lobe. It's planning, impulsivity, organization, So some people, if they have an injury to that, then can't really do any of those. But for people who don't have an injury to that part of the brain, you have to kind of do some of these techniques that we've discussed, and it's not going to take that away forever, but might help in the moment.
You know what my favorite thing about CBT therapy, which I've undergone a few times, and it's weird because you would think it would be my least favorite thing, is the homework. Like
Right.
every time I've done it, I've gotten homework. And here's the truth about me, and I think it's the truth about a lot of people when they're like trying to deal with something going on with them mentally, is you can internalize or you can know what you're supposed to do, but until you do it, until you've internalized it, knowing doesn't mean anything. And like I found when I started doing CBT therapy that them being like, hey, you need to do this, and then kind of getting called out when I wasn't doing it, got me to start actually doing it. And then because I was doing it, I internalized it, and then it actually became a tool that I could use versus a tool that I was familiar with that I never used.
Yeah, and you can practice. That's something you practice maybe with your therapist. You guys do role playing. You work on it like at home, maybe with a significant other. Important. Real quick, I just wanted to add that it's not the prefrontal cortex; it's the frontal lobe. So I misspoke earlier, but yeah, people learn very differently. Some people learn visually. Some people learn by someone like lecturing them, like didactically. More experiential. So you have to be aware kind of how you learn the best. And, the fact that people in cognitive behavioral therapy do give homework almost every week. Some people, they're like not doing that. I'll seek out some other type of therapy. Other people are like, yeah, bring it on. I'd love all those worksheets. Give them, anything you have, give to me. Some people really vary in their opinion of that, but I think it's super helpful because, meeting with someone for 45, 50 minutes once a week, for the most part, that's how we meet with people. That's not that much time.
Yeah.
You have the whole rest of the week to be anxious or depressed or whatever. So 45 minutes probably is, again, just kind of, you need some extra time dealing with anxiety.
There's things I'm curious about, and one of them is it's just popped up. Is there a link between caffeine and anxiety? Where I feel like
I would imagine so. I don't know if there's many studies, but I would be surprised if there wasn't.
Aaron, I feel like you have something on that.
Oh yeah, absolutely. Like for a number of reasons, limit my.
Let me add that. Is there a link between like coffee or tea? Caffeine as well. I feel like there's maybe two different type of anxiety that people might.
Tea has more caffeine, I think, than coffee, actually, which surprises almost everyone who hears that. But it does, like black tea specifically. Not as much green tea. Mm-hmm. But yeah. And Aaron, I think you were going to say something to this topic.
Sorry, I'm so excited. I don't know. Excited isn't the right word. But yeah, I intentionally limit my caffeine intake, partially in part because of anxiety. And I can say for me, limiting my caffeine intake has a positive effect on anxiety. And with coffee, I think that the perception is that it makes you more anxious, but I think that that's just a societal expectation because you see people drink coffee and kind of like get to work, whereas you see people drink tea and relax. And so there's, at least to me, I feel like there's a mental thing where you're like, oh, I'm supposed to be active here, or I'm supposed to be relaxed here. And also a lot of the teas that I drink are green or white tea, which is like much less in terms of the caffeine.
Yeah.
I've never thought about it as a societal expectations. So thank you for mentioning that. That's
just my theory. There's no studies on that.
Look at caffeine and when you see people drinking it and like how they feel on it as well.
Yeah, that earlier when we were talking about the bell curve and like to a certain extent anxiety helps you. Like I used to drink coffee when I was in college. I don't drink it anymore. When I was studying, so I'd have like a cup of coffee and I'd be like, okay, this is great. I can totally focus. Then I have another one and then I'm like, oh man, that was way too much. I can't even like read what I'm supposed to be reading right now because I'm so like all over the place. So yeah, there's definitely a point of no return with how much caffeine I could ingest.
I think it's also like in terms of caffeine and anxiety, I think it's also important for uh, specifically people with ADHD. I don't know about other neurodivergences, but I've seen, and I've done this as well, but I've seen a lot of people with ADHD self-medicate using caffeine.
Uh-huh.
Um, and like the thing is, it works. It just has more issues that come along with it than just taking the medication.
Right. Well, I feel like it's kind of the same theory that, for like why you would take medication. They're both like to take a stimulant when you are like hyperactive seems totally counterintuitive. Now it works, and I don't know how it works. I'm sure there's someone out there who does know how it works. I don't know exactly why that works, but it does. I feel like with coffee, it would be something similar. But then people who drink like a ton of caffeinated coffee all day, because some people drink it all day. Um, besides, then when they try to wean off, they get headaches. They're crabby. They're not feeling their best when they try to like titrate down on coffee.
I was looking into this years ago when I was drinking a lot of caffeine and also having a lot of insomnia. Go figure they were related. But
Yeah.
I I do remember that the half-life for coffee is obscenely long. It's like 8 hours, 6 or 8 hours or something like
Really?
that. Like it takes a really long time for it to actually leave your system.
Oh, well, yeah. Then when people keep drinking another cup and another cup, then yeah, that adds up to a whole lot of sleep problems, most likely. And, a lot of people I know drink it and they think it suppresses their appetite for some reason. I don't know if it does or doesn't because I don't drink it, but
Heard of that, yeah.
yeah. So I don't know if it does, but I think that would be a motivating factor for some people if it did. If anyone's interested in eating less.
I will say to bring things back to anxiety,
Yeah.
I have seen and not very often, but I have seen somebody who's just normally very anxious drink a ton of caffeine and just go off the wall with anxiety where you're like, oh my gosh, there's a problem. But I've also seen it go the other way where they drink caffeine and they're suddenly feeling empowered, uh, and the anxiety abates, which to me is just incredibly curious because you would think, like you said, it's a stimulant, it's going to just ramp up what's already going on, you know?
Yeah. Yeah.
It was like
Um,
2 years ago I found out that I never thought about it. That soda had caffeine in it. And it just like it was mind boggling. I was like, no way. That is not true.
yeah. I mean, anxiety, then some people when they get really anxious, use substances that are not helpful at all, like alcohol, drugs, to kind of, non-prescription drugs or abusing the prescription drugs, to help calm their anxiety. And that's not, a recommended method, because it can get out of control. I guess if you have like a glass of wine after you did your presentation, that maybe will help you be like, okay, it's over. I got through it. I'm less anxious. This is relaxing me, and then move on. But it's definitely not. You don't have to do that. Maybe some people it wouldn't work for. It just depends on the person.
Yeah. I do think that's really important with everything that we discuss on this podcast, but also with anxiety is that different tools, different techniques, different medications work differently for different people. Like there's some things that I've heard other people talk about in terms of managing their anxiety or depression that I've tried and have done absolutely nothing for me. But there's other things that I've done and it's like, oh, this is really helpful.
Yeah.
Which I think is part of the reason why it's so important to have a trial and error area. I think therapy is a great place to do that, probably the best place to do that. Um, but what I have seen for a lot of people, unfortunately, is that, especially with anxiety, is that they'll be suffering from anxiety and they'll hear of, one or two things that they can do, and they'll try it once or twice and it doesn't work. And then they're just like, okay, this is me forever. And then their anxiety just
Right.
grows and grows and grows and grows and grows.
Well, in terms of medication, there's medication that you take every single day, like Paxil, that's for example, and it builds up in your system. And then there's medication you take as needed, like a Valium, like a Xanax. Um, you only take right before like an event where you're going to get really anxious, or like if or if you're at home and you're just getting really really anxious, then you might take one. Some people do, some people don't. But
Mhm.
there's two different like classes of medication for treating anxiety. And I think the most important thing to remember is that if you avoid what you're anxious about, it only makes anxiety stronger.
Mm.
Avoidance is not the answer. In fact, it makes it much stronger. So you don't want that.
That's one thing, and speaking of avoidance, that I've noticed for me, and I don't know if it applies to everybody else, but one of the things that really helps reduce my anxiety when I'm experiencing it is action. Um, Doing something. Like it can be, going to the gym, it can be writing, but doing something helps bring me back to a point where, well, I can go to sleep. But I think that may not apply for everybody, especially because for me, my anxiety always happens in the middle of the night. During the day, I'm usually fine. It's the
Yeah.
middle of the night where it's like, hey, wake up. It's time to worry about things that don't matter.
Your mind's just
Um,
racing.
yeah, yeah,
And in the middle of the night, you jump to the worst conclusions, I find. You're not
yeah,
thinking of like really good ways to overcome this. You're just going to worst case scenario for everything that you're thinking about.
yeah, yeah. So for me, that's why the action is very helpful. Like sometimes I'll journal or start writing things. Sometimes I'll start exercising. But I found that if I don't start burning off that anxiety in some way, it just gets worse and worse and worse and worse and worse. And then dawn comes and the entire day I'm just a wreck.
Yeah, I'm probably exhausted too because you probably didn't sleep very well. So you're up
Yeah.
worrying. Yeah, that's not a good combination to be excited to have be anxious and tired.
I also feel like people kind of hide their anxiety because they're afraid to mention it. Um,
Yeah.
on that note, Dr. Tilton, like, what I feel like the brain chemistry might be the same for everyone to experience anxiety. Is that true, or that's
Well, it differs between people,
okay?
depending on like, the level of like serotonin or dopamine. Dopamine is like our reward center.
Okay.
Um, you know, and then that would also dictate what type of medication they would put you on, whether, like a selective serotonin reuptake inhibitor, SSRI. Um, so maybe, it would just, that information would dictate what they put you on. I see, that okay, just looking at Liam's question, in terms of being able to change your sleep cycle because of your anxiety, if you're staying up all night, I think the best thing is to gradually, like, some people will do this. We suggest that people do this. Like they pick out a time during the day that they worry about. You're like, all you do for 15 minutes is sit down and write, stream of consciousness, what you're anxious about. And then after that timer goes off, you do not think about it the rest of the day. Sometimes that then helps people sleep better because they already worried about it. So, and some people then after they do that for 2 or 3 weeks are like, I'm so sick of writing about this. I'm like become less anxious because I don't have anything left to say about it. It's helping me not worry about it. That's one thing you could do. I mean, you could always change your bedtime, a little bit, just to, because maybe you're going to have that anxiety, maybe go to bed an hour earlier, and then maybe that will help. I don't know. I mean, anxiety in the middle of the night, I don't have a lot to say on that because I don't know. It's not in the books that I've been reading, and I do it. So that's a great question. I wish that I knew the answer. So I'm sorry I don't.
So I could say this just because I've dealt with insomnia my whole life. But one of the big things that really helped me in terms of getting on a regular sleep schedule because of like anxiety-driven insomnia is don't do anything in your bed other than sleep. And when you like wake up in the middle of the night and you have anxiety, give yourself like 10, maybe 15 minutes to fall back asleep if you don't get out of bed.
Yeah, that's sleep hygiene. I was just gonna say a good sleep hygiene would be a very important factor. And Erin's exactly right. That's what they tell you. Like, you don't use your computer in bed, you don't read in bed, you sleep in your bed. There's not supposed to be any TV in the room, like when you're not scrolling before you go to bed. You just take that time to like decompress. Put your phone, if you use your phone as an alarm, turn it over. So if someone like texts you or whatever in the middle of the night, you don't see the screen light up. Another thing is you don't take naps. Because some people are so tired that they're like, I've got to take a nap. But then you're less tired at the end of the day. And it might impact your ability to sleep through the night because you've already been sleeping during the day. Or that if you do take a nap during the day, it's like 15 minutes. It's not an hour and 45 minutes.
I was going to say I'm a perfect napper.
Yeah.
But it's power naps.
Yeah. I should say it's a kind of nap, not
power naps, and then I'll sleep great through the night as well.
So
napping is a big key for me.
Yeah, it was funny because I was talking about bad sleep with my father, and he was an executive. He would tell me that every day about 3 he would get so tired because he'd been up since like 6, and he's like, I would lock my door and take like a 15-minute nap, he's like, just my chair. I just closed my eyes. He's like, I felt so much better after that. I could totally get back on track and focus. So, it really works for some people.
Absolutely. I mean, I think as we sort of get toward the end with time, I think and please correct me if I'm wrong, if either of you took something else away from this, but I think one of the things, or the 2 big things that I kind of get from this conversation is, one, anxiety is manageable.
Absolutely.
There are medication, tools, techniques that people can use to get it under control. So, get it under control. And then the other thing is that everybody's different. What works for you is not going to be what works for everybody. Try different things.
Mm-hmm.
No, on the same boat with that, Erin, like lifestyle foundations, healthy diet, eating regularly,
exactly.
Reducing your caffeine intake, seems like, and alcohol, deep meditation, and then CBT, and then medication as well.
Exactly. And there's that gene site, that gene test you can take now for psychotropic drugs, and I always encourage people to do that because they just swab, inside your mouth, and then they can tell like which medications would work well for you, not work well for you. It's amazing.
Okay.
Because you don't want to waste your time with something that already you have like proof that it's not going to work. So I don't know exactly how accurate it is, but I know a lot of people do it these days. There's a psychiatrist could do it, or probably your primary care physician.
I will say, like, especially the medication thing. I feel like a lot of people get turned off of psychiatric medication because they had a bad experience with one, which absolutely happens. And then
Right.
they kind of say, oh, they all stink and do this to me. And that's not the case.
Yeah, and sometimes you do have to try 2 or 3, which people get frustrated and they're like, "I'm not a guinea pig. I don't want to do this." But you're like, when you find the right medication, I'm like, it will change your life. And therapy is important too, but it's a biochemical problem that we're having, and so medication makes a lot of sense for many people. Not for everyone. Some people just don't like to take medication of any kind, and that's, I respect that too.
I also think like with the medication, some of us, our bodies just don't set us up for success on certain things
Hmm.
and for whatever reason. And in that case, the medication can be very helpful, not, to be successful, period, but just to get to a point where you're not set up for failure internally, with the chemicals that are going on in your brain. And from experience, I can say like when you get to the right medication, it does change your life. It's a
Yeah.
lot easier to manage things.
Well, and often even like I've encountered people who were so anxious they couldn't even get to the therapy office. They're too anxious about what was going to happen. They're just too anxious to like even leave and get in the car to go. They're anxious driving. So, you want people to be able to make it to therapy, whether it be telehealth or in person or whatever, to feel better enough to move forward.
Absolutely. And that's really what it's about for all of these conversations is, you know, what can we do to help us move forward?
Yeah.
Um,
Yeah. And I often
but
see it
I
in
want to,
clients. I'm like, do you want to feel like this for for the next, for the rest of your life? Because it doesn't seem like a very pleasant feeling. There's answers. And, if you decide not to do it, I mean, that's a decision as well that you're making. So, there's consequences to some of those decisions. One is you don't feel good.
Yep.
absolutely. Well, thank you both so much for joining us today. Thank you for everybody else for joining us. Don't forget to hit like and subscribe. Check out Lamco Wellness at lamcowellness.com, and thank you to them as our sponsors. And we'll see you next time.
Bye.
Thank you.